All right, good morning, everyone. Thank you for joining us for the S Word. Let's talk about suicide. I'm Melissa Moore. I'm the Public Health Coordinator with the Taylor County Health Department. This day, we're very excited to be able to welcome 5 excellent speakers to talk about this very important topic during Suicide Prevention Month. As you go through the day, you can pop in and pop out. We'll have 15-minute breaks approximately between each one of our sessions, and we are scheduled today through 5 p.m. Before we get started, I just want to recognize our educational partner, NTC, the Training and Workforce Development. Close enough. Close. NTC has been great to be able to put this on for us today, as well as our funding partner with the Advancing a Healthier Wisconsin Foundation. So big thanks to them. Welcome everybody that's joining us virtually on our 6 different campuses in the NTC district, as well as those that are joining us via Zoom and anyone that's viewing these recordings after on our YouTube channel. 4 out of our 5 sessions will be recorded today and available on that YouTube channel, which will be up in a later slide. But before we begin, I just want to do a brief message from our funding partner at the Advancing a Healthier Wisconsin Endowment.
Hello, my name is Iguchi Madokwe. I am the Deputy Director of the Advancing a Healthier Wisconsin Endowment, and I'm honored to join you at this important learning event focused on building capacity to prevent suicide in Wisconsin communities. The Advancing a Healthier Wisconsin Endowment, or AHW, is Wisconsin's largest health improvement philanthropy and the only health philanthropy in the nation stewarding public funds from within a private medical school, that school being the Medical College of Wisconsin. AHW was established by MCW as the result of a generous financial gift made by the Blue Cross and Blue Shield United of Wisconsin to the people of Wisconsin, giving AHW the extraordinary responsibility to steward this financial gift on behalf of Wisconsin residents. We do that by investing in promising biomedical research, supporting community health initiatives, and building the health workforce needed by Wisconsin. Since 2004, AHW has invested in $337 million in 600 projects. The Learning and Event Support Grant we provided to the Taylor County Health Department for this event is just one of many funding opportunities AHW offers to community-based health organizations and other nonprofits, as well as MCW researchers to propel promising work and ideas aimed at improving health and advancing health equity in Wisconsin. I invite you to visit ahwendowment.org to learn more about opportunities to collaborate on our shared vision of a healthier Wisconsin. Thank you and enjoy this day of learning and networking. I have no doubt you will receive both information and inspiration that will benefit the important work you all do.
So today, instead of having a number of handouts that are going to be available in print for individuals that are attending, we have started loading everything into a resource drive. So this drive, you can either scan it now, will be sent out after the event to attendees, but it is something that we will continue to add resources to. So you can either scan this with your phone or visit that link. And this will be up again at the beginning of each session. So if you miss it now, we'll be able to get that to you. For those of you that are attending virtually, we'll also have this in the chat shortly, as well as those that are viewing on YouTube. It'll be listed in the comments section below. So our first presenter is Sara Kohlbeck from the Medical College of Wisconsin. We'll be bringing her up now. We'll get her presentation going, but her learning goals, we're going to be talking about youth as our first population of focus today. Everyone in the drive as well as in person will have a handout that summarizes all of our events as well as the bios from our presenters and their contact information should you need it. If you need anything online, those of you that are attending virtually, Leslie and I will be monitoring the screens. You can put your hand up or indicate somehow you have a question. We also have chat features, so we'll be pulling those up at different times throughout the presentations today. Thank you. And Sara, it's all you.
Thank you so much. Thank you for having me. I'm really excited to be here in Taylor County. I was actually up here last year around this time, actually. I think it was maybe late September, early October, talking about youth suicide prevention. And so I'm really glad to be back. So as Melissa said, my name is Sara Kohlbeck. I am with the Medical College of Wisconsin. I direct the Division of Suicide Research and Healing. And I also want to note that I am a volunteer with the American Foundation for Suicide Prevention. I'm actually the president of our board here in Wisconsin. And so I'm really, really happy to be here today to present this educational program, which is called More Than Sad. It says suicide prevention education for parents, but this is really meant for any adult that cares for a young person. And again, I'm really excited to be here with you all today to talk about this important topic. I do want to just, before we get started, note that suicide obviously can be a sensitive topic to discuss. It's the topic that we're going to be talking about all day today. We know that, talking about suicide is really critical to prevention. And we're grateful that you're here today. But at the same time, if you feel the need to step out, those of you that are on Zoom, maybe turning off your camera and stepping away from the computer for a few minutes, please feel free to do so. I do want to let you know that Gina Orlando, who is presenting a bit later today and is also the area director for Wisconsin for AFSP, is here and can be a resource person if anyone needs as well today. So overall, with today's presentation of More Than Sad, we hope that you are able to learn a little bit more about suicide prevention and become a little bit more comfortable talking about this topic, especially as it relates to youth. Before we get started, I just want to remind folks that how we talk about suicide matters. And I think for many people, this is probably something that you're very familiar with. But just in case, I wanted to go over some terminology that is used when we talk about suicide. It's really important to model this appropriate language so that we are not perpetuating the stigma around suicide or around mental health challenges. And so because of this, we avoid using phrases like committed suicide or commit suicide because that can have a negative connotation. We think about committing crimes, committing sins, so that we really have that negative connotation associated with that. And instead of using committed suicide, we encourage phrases like died by suicide, ended his or her or their life, killed himself, herself, or themselves. Very plain, objective language that doesn't, sort of connote any judgment. And then also when we talk about suicide attempts, we avoid referring to those suicide attempts as either failed or successful. Not only is that language unnecessary, but it also can imply judgment. And again, so we really suggest just being very objective, using objective language and saying things like suicide attempt, non-fatal suicide attempt, or death by suicide. And it's important to highlight this because suicide, educating the public about this terminology is really critical for encouraging help seeking. When there is a high level of stigma around suicide in the community, that can really hinder folks from talking about their issues and from seeking help. And we also want to be able to raise awareness of risk in vulnerable populations and then advocate for new interventions and prevention strategies for those who are at risk for suicide. And so when we talk about suicide safely and accurately, we can help reduce the likelihood of its occurrence. So here are our goals for today's presentation. We're going to be looking specifically at teen depression and suicide risk. We'll spend some time identifying warning signs and risk factors for suicide in teens and young adults, and we'll look at the role of mental health care in reducing those risks. And finally, we'll discuss ways to start a conversation with your child or a child that you care about depression and suicide. I know talking to young people about mental health and suicide can be really challenging, especially if you're a parent. It can be a little bit scary to have these conversations with your young person. And hopefully after today's presentation, you will feel a little bit more comfortable having that conversation with the young person that you care about. Before we get started, I just want to go over some key terms that we will be referencing in today's presentation. The first is suicidal ideation. When you hear that term, it simply refers to any thoughts of suicide. Suicidal ideation can be expressed as suicide behaviors, which refer to any acts or behaviors that lead up to a suicide attempt. We also know that not all acts of self-injury are suicidal. Many young people engage in non-suicidal self-injury that can refer to things like cutting, burning, and scratching. When you see these non-suicidal self-injuries, there's no intent to die associated with those. Typically, those non-suicidal self-injurious behaviors are that young person's way of coping with what they're experiencing. On the other hand, when someone makes a suicide attempt, there is that intent to die. These attempts may or may not result in physical injury. The person may or may not need to seek medical care, but the intent to die was present. So that's really what distinguishes that from those non-suicidal self-injuries. And then finally, suicide is defined as a self-directed, injurious behavior with the intent to die that results in death. So let's start by getting an overall sense of the scope of suicide. These numbers have been updated a little bit. If you know anything about surveillance data, you know that it's lagged, unfortunately. So this data as of 2021. And in that year, a total of 48,183 suicide deaths were reported in the US, which is an increase over what we have seen in previous years. And that works out to a suicide rate of about 14.08, which means that about 14 suicides were reported for every 100,000 people in the country. At that rate, suicide was the 11th leading cause of death in the population overall. Prior to 2020, suicide was generally the 10th leading cause of death, but with COVID, we have seen that trend shift a little bit. And over half of all reported suicides in the United States in 2021 were by firearm. When we talk about young people between the ages of 10 and 24, which is really kind of the focus of today's presentation, there were 7,126 reported suicides, which represents almost 15% of all suicides in that year. So youth suicide comprised about 15% of the total for the country. And that works out to a suicide rate of about 11 per 100,000, making suicide the third leading cause of death among youth. I will note that the presentation says the third leading cause of death. It's actually the second leading cause of death for individuals ages 10 to 14, and then 20 to 24. It drops down to the third leading cause of death for those 15 to 23-year-olds, but it's the second leading cause of death for those younger folks. That being said, it's really important to note, kind of in the context of health, that it's very rare for a death from any cause to occur in this age group. So it still is a fairly rare outcome, but we know that for every suicide that occurs, many, many people are affected. The other thing I want to stress with this slide is that the word reported is in italics, and that's because suicide has been historically underreported. And there are a lot of reasons why this is the case. Sometimes the stigma surrounding suicide makes it really difficult for families to classify, or for medical examiners to classify a death as a suicide. And also the cause of death can be difficult for a coroner to determine, particularly if there isn't a note, or if especially with overdoses and things like that, it can be really, really difficult to determine the intent that the person had. And so even with these numbers, we know that suicide is largely underreported. So this graph shows suicide rates across the lifespan. So the numbers kind of on the x-axis are ages. And then on the y-axis, that vertical line represents the suicide rate per 100,000. And so we can see that suicide under the age of 10 is quite rare, and that suicide rates increase more dramatically during adolescence and early adulthood, really than any other stage of the life cycle. In particular, we see rates dramatically increasing after age 12 and through about age 22. The other thing I just want to point out, though, given that dramatic increase, is that suicide rates for adolescents and young adults are significantly lower than those for people in midlife and the elder age groups. And that's the case. I know this says U.S. suicide rates, but that's also the case in Wisconsin. The highest rates of suicide we see in our state are typically in kind of that middle age group, 45 to 54, and then folks over age 85. But we have in the past few years started to see increases in teens, like ages like 12 to 17, particularly for youth of color in the state. This graph is looking at suicide rates over time. And these rates, again, are number of deaths over 100,000 people. So keep in mind that a group can have a high rate and yet not account for the highest number of suicides just based on how many people are in that particular age group. So what you can see from this graph is that the rates of suicide have gradually increased over time, with a slight decrease or plateau in 2019 for most age groups. The highest rates of suicide in the United States have been among those who are middle-aged and those over 75, which again is mirroring what we see here in Wisconsin. There has been a slight increase in the suicide rate for individuals ages 15 to 19 over the past 20 years. And it's important to note that because deaths by suicide in this age group are relatively uncommon, even small changes in the number are going to have a really kind of marked difference in the rate. The suicide rate for youth under the age of 15, which is the line that's on the bottom of the graph here, kind of down here at the very bottom, is by far the lowest in incidence. However, the loss of a young person under the age of 15 can also impact an entire school and community and put other children at risk as well. And that's where this presentation really can help. There is a lot of room for intervention within this age group, and participating in this presentation today is one important way to learn how to take action. This graph shows a comparison between the suicide rates for males between the ages of 10 and 24, which are marked on the blue by the blue bars on the graph, and those for females in the same age range shown in yellow. So you can look at the difference in sexes here. And you'll notice that at age 12, we can see that there is really little difference between the suicide rate for boys and girls. But by age 18, the boys' rate is actually 5 times higher than the girls' rate. And this difference between the sexes remains through young adulthood and peaks really, as you can see here, at age 22, when the male suicide rate is more than 6 times the female rate. And a lot of people ask, why is there this difference between gender? And there are some kind of prevailing theories around that. One is that it's just more culturally acceptable for girls to seek help. We've made space in our culture for girls to be able to talk about feelings related to mental health. And that's not the case for boys. I see that with my own kids. I have a daughter and a son, and the difference in the way that they talk about their mental health is very different. We also know that gender differences in traits like aggression and impulsivity are thought to contribute to the higher rate of suicide in males. We know, generally speaking, that males have lower impulse control than females do, just due to genetic differences in the brain. And so that's certainly thought to be a contributing factor. And then the final reason is that boys or males tend to use more lethal means in their suicide attempts than girls do. Males are much more likely to use firearms, although that is also changing. We are seeing higher rates of firearm suicide attempts in females as well. But traditionally, we see boys using more lethal methods and girls using methods like poisoning or hanging, which actually have a much higher chance of intervention and then being able to save that person's life. When we look at youth suicide rates for those ages 10 to 24 by ethnicity, what we see is that Native Hawaiian and Pacific Islander and white youth have a suicide rate above the national rate for this age group. Here in Wisconsin, the rate of suicide for youth is actually highest in our Native American population, which is not typically highlighted, I don't think, in a lot of the discussion that we have around suicide, particularly among young girls, and, well, I should say both young girls and young boys in the Native American population. So even greater than white youth. And so when thinking about targeting intervention strategies, it's really important to take that into consideration. We know that when we talk about suicide, though, suicide death is really just the tip of the iceberg. We need to kind of look at the whole picture of suicide as a health outcome. And one way to do that is to look at suicide attempts. The CDC gathers hospital admission data for non-fatal injuries that are related to a suicide attempt. And for young people, this tells us that there are an estimated 100 to 200 suicide attempts that require medical attention for every reported death by suicide. So thinking about kind of that under the surface outcome, which means that approximately 3% of youth that are in high school have reported making a suicide attempt that required treatment by a doctor or a nurse. And we only have data for individuals who are admitted into medical hospitals for self-inflicted injuries. So this number is really conservative because many suicide attempts do not require medical attention. Youth are in general more likely to survive suicide attempts because they live with others who can rescue them, who are able to, kind of find them and intervene. They have healthier bodies that are able to bounce back from injury a little bit better than adults can. And they also have less access to lethal means, particularly in homes where firearms are stored safely. A really important piece of information here is that suicide attempts are really opportunities for us to intervene and help young people get healthy. We also are able to look at other data that is based on the National Youth Risk Behavior Survey in Wisconsin. We also have our Youth Risk Behavior Survey that gives us a lot of good information about what's happening. This data monitors health risk behaviors that contribute to the leading causes of death and disability, and also social problems among youth in the U.S. The YRBS Youth Risk Behavior Survey is conducted generally every 2 years during the spring semester and provides data for now both middle and high school students in public and private schools throughout the U.S. And according to, and again, this is national data, according to the most recent YRBS survey, roughly 22%, or 1 in 5, of American high school students report that they have seriously considered attempting suicide in the past year. About 18% report having made a plan, and about 10% report having made a suicide attempt in the prior year. Again, these are national numbers. I can tell you that in Wisconsin, our numbers are fairly similar, where about 1 in 5 students consider suicide among our high school students every year. And again, the Youth Risk Behavior Survey is based on self-report data. So this is likely an underrepresentation of what the burden actually is. A really kind of key thing that I want folks to take away today is that when we hear a young person speak of wanting to take their life or indicate that they are thinking about suicide, we have to take it seriously every time. Some may think that teens talk about suicide for attention, but it's important to take all threats of suicide seriously until that young person is seen by a mental health provider. When I've done this presentation, I get a lot of questions. About hearing young people say all the time, "Oh my God, I'm going to kill myself. This makes me want to kill myself." All of those comments need to be taken into context, especially if you know the young person well. That can be an opportunity for you to have a conversation with that young person and say, I want to just address and, see how you're feeling right now. It's maybe not a good idea to say things like that, if you are, kind of just using it jokingly, because that can really contribute to stigma. It's like when people say things like, oh, I'm feeling bipolar today, or this weather is schizophrenic. It's really those unsafe language situations. So that's an opportunity for you to have a conversation with that young person and say, I really want to take this seriously. I want to check in with you and see how you're doing. And at the same time, just be careful with how you're talking about these different mental health issues, because again, it can really contribute to that stigma. It's always easier to have these conversations with young people that you have a relationship with. But if you are encountering a young person using this type of, saying things like they want to take their life, and you don't know them well, it's important to take that seriously, even if you think they might be, just kind of saying it or joking. Sometimes when young people are thinking about suicide, they might try to play it off as a joke, but when you ask them about it, you open that opportunity for a conversation. So when we focus on mental health conditions, obviously that's important in the context of suicide, but it doesn't really give us a full picture of the complexities of suicide risk. So we're going to spend some time talking about risk factors for suicide among youth. Risk factors are elements that are present in a person's life that increase their suicide risk. And these main risk factors can be kind of grouped into these three categories. The first is health factors, which include biological and psychological aspects of a person's health, including the presence of a mental health condition. Historical factors are things that happened in the person's or the family's past history. And then we think about environmental factors, which include society and cultural factors, access to lethal means, as well as individual life events. In general, we think about these risk factors as longer term, sometimes lifelong issues that signal the need to be proactive, as proactive as you can be when it comes to mental health. But we know that the presence of these risk factors does not indicate that an attempt will necessarily be made. In fact, most people who have these risk factors don't attempt suicide. And we're going to talk a little bit about when that changes in a bit. Research has shown, and emerging research has shown, that a majority of those who die by suicide kind of across the lifespan have a treatable mental health condition at the time of their death. As with other conditions, early identification of these mental health issues can save lives. A lot of people that are living with a mental health condition are either undiagnosed or underdiagnosed, and also untreated or undertreated. And so, mental health is definitely a big part of suicide, even if a person's condition isn't maybe diagnosed or treated. And the other thing I want to point out is that emerging research has shown that, as is the case with what we know about those who attempt suicide at all ages, teens who attempt suicide do so as a result of many factors. It's not simply, a breakup or a bad test score or, not being accepted to a college. It's typically many factors that are coming together. But that being said, teens may have lower rates of mental health or mental illness than people who attempt later in life. Suicide risk in teens is most clearly linked to mental health conditions, which can occur together, which will increase risk further. And so you can see some of the mental health conditions that have been linked with suicide among teens, including things like major depressive disorder, substance use disorders, eating disorders, generalized anxiety disorder, schizophrenia, and bipolar disorder. Major depressive disorder is the most common mental health condition that's diagnosed, and it's also the mental health condition that's most connected to suicide across the lifespan. I also want to note that disruptive mood dysregulation disorder is a new diagnosis in the DSM-5, and that has been characterized by extreme irritability, anger outbursts, and inhibited self-control in youth ages 6 to 18. And youth with this diagnosis have also been noted to have a higher risk for suicide. So it's not included on the slide, but I just wanted to make you aware of that. When we talk about youth suicide, one of the things that we hear about a lot is bullying, particularly when a youth is experiencing bullying in the school environment. And I just want to note that the relationship between bullying and suicide is complex. When other risk factors are present, being bullied can be a precipitating stressor that can increase risk further. And research has shown that persistent bullying that can actually lead to or worsen a young person's feelings of isolation or rejection or exclusion and despair, as well as depression and anxiety, which can contribute to suicidal behavior. I also want to note that bullying behavior also indicates underlying risk in the bully themselves. So really any involvement with bullying behavior, either as the bully or the victim, is a stressor, which can significantly contribute to feelings of helplessness and hopelessness that raise the risk of suicide in teens. That being said, though, suicide is not a natural response or a reasonable solution to bullying. Bullying is one factor, but it does not directly result in suicide. And suggesting that is the case could actually increase contagion risk. It's important to note that the large majority of people who experience bullying do not become suicidal. So I think, as we're talking about bullying, particularly in the school environment, it's important to talk about the other factors that are happening in that young person's life, and sort of break that common notion that bullying causes suicide, because research has really shown that it's much more complex than that. I also want to talk about social media. The research in this area is emerging, and social media continues obviously to evolve at a very rapid rate. A lot of people utilize social media with a mixture of both positive and negative effects. For young people with risk factors like depression and anxiety, low self-esteem, or extreme interpersonal sensitivity, social media can really have a negative impact on their mental health. It's also important to note that young people may also use social media to reach out for help or to indicate their distress, either behaviorally or verbally. For example, we might see a young person suddenly disconnecting from social media, making statements on social media indicating a desire for suicide or to die or to escape their pain, or disclosing that they've gained access to lethal means. So just like we encourage young people to alert adults if they notice or hear these things being said by their peers, they should also be encouraged to notify an adult if they are concerned about a peer or a friend's social media posts. We know, and this is true for adults as well, that heavy use of more than several hours per day of social media is not recommended. Social media utilization ideally should be limited in quantity and approach. Some people astutely take long breaks from social media for their mental health, because they have learned that this is an important part of their overall wellness strategy. So I think the important kind of takeaway here is that, social media can certainly have negative impacts on young people. It can also be a positive source of connection. So there's kind of that fine line. And so, as an adult, like I said, encouraging those young people to reach out if they're seeing something concerning that their peers are posting, reaching out to a trusted adult, and also helping young people to kind of regulate their social media usage can be helpful. All right, so we are going to watch a video. This is AFSP's Chief Medical Officer, Dr. Christine Moutier, who's going to talk about the risk factors and warning signs that contribute to suicide risk. So I think I'm gonna have to stop sharing and then reshare, because the video actually pops out in a different, it should be, oh, okay, well, let me try this.
It's not just about whether life is worth living. Suicide is a health issue.
They'll be able to hear it. Thank you. Oh, there we go. You're amazing. Thank you.
And it's largely preventable. Suicide happens when multiple factors come together, so it's not related to just one cause. You can think of the underlying risk factors for suicide in 3 different buckets: biological, psychological, and past history. Biological risk factors for suicide include things like mental health problems, like depression, anxiety, or substance abuse. Those are all risk factors for suicide that underlie and may not have even been recognized at the time the person dies by suicide. Psychological traits that present a risk for suicide are the tendency to interpret life's events in black and white or catastrophic ways, to be impulsive, aggressive, or extremely perfectionistic, and those don't allow us to be as flexible and to cope quite as well with life stressors. Past history can really put somebody at risk for suicide in a way that becomes an invisible layer because it might have happened many years ago. Things like a past history of childhood abuse, or a past history of severe brain injury, past history of personal suicide attempt, certainly, or a family history of a suicide. Those are all historical events that place a person at higher risk for suicide. On top of all of those underlying risk factors that can be quite invisible to people around that person, of course, there are life events going on for all of us, stressful things that we're dealing with. And so for individuals who have some of those underlying risk factors, those stressors that they're facing in their current day life can absolutely precipitate a crisis. One of the biggest risk factors when it comes to suicide are mental health problems. What research shows is that 9 out of 10 people who have died by suicide did have a diagnosable mental health problem at the time of their death. It may or may not have been recognized or been treated. And so that means we really need to look out for one another. We need to learn the warning signs for suicide risk and know what to do when we see that. Just like we do for CPR or first aid, we can recognize when somebody is suffering from a heart attack or another physical illness in a crisis. So some of the warning signs for suicide are changes in behavior. The people around you that you've gotten to know well in your family or in your friend group, they have patterns of behavior. And when those patterns change significantly, take note of that. Speak to them if you're concerned. Some of those symptoms look like changes like this: withdrawing socially, isolating from you or from their normal life's activities, becoming agitated or easily angered, which we don't often associate with depression or suicide risk, but agitation absolutely is a very common experience when it comes to people who are feeling suicidal. Increase in anxiety, changes in sleep patterns or appetite, those are all warning signs that the person's mental health is deteriorating. Certainly, if they begin expressing any thoughts about life being not worth living, or thoughts of ending their life, or even if they're not saying it, but they're doing things that seem odd, like giving their belongings away, those should all be taken very seriously. And if you notice things like that, certainly speak to the person in a caring way, and you can also lead them to help. Unfortunately, there's a lot of stigma attached to these kinds of experiences that relate to mental health. So many of us actually hide or cloak the distress that we're in. We keep our experiences very internal rather than reaching out and connecting with support. We need to do everything we can as the role that you have in your family and in society to shatter the stigma, to talk about mental health as any aspect of health like any other, and to approach people that you're concerned about and be open with what's going on in your own life as well. Having the risk factors that I just went over does not mean that a person will die by suicide, but it does mean that we need to do a better job of looking out for one another. There are also protective factors that come into play and that we can think about shoring up for ourselves and helping our loved ones to improve upon as well. Those protective factors against suicide risk include things like feeling connected to your family, to friends, and to your community. Having a regular source of health care, including mental health care, and feeling supported in that. Learning good coping strategies in life is very important, and we can start teaching our kids that at a pretty early age. The last protective factor is knowing the signs that you are needing to seek help. It's the smart and courageous thing to do. It's not a sign of weakness to reach out and get help when you need it.
I think I got it. I just need to okay, got it. Perfect.
If you're concerned about someone who may be struggling in your life, the right thing to do is to open up a caring conversation and ask them how they're doing. Ask them directly about whether they're having suicidal thoughts. That will not...
Okay. Sorry, folks. Okay. So we're going to move on and talk a little bit more specifically about how to identify teens who might be at risk for suicide. With young people, it can be easy to mistake mental health symptoms for other typical youth behaviors, such as normal kind of adolescent mood swings, laziness, poor attitude, or immaturity. That being said, these perceptions that adults have of these different signs might keep young people from seeking help, which again is why it's important to take talk of mental health, mental illness, or suicide seriously. When you notice a change with a young person, it never hurts to have a conversation with that child about what you're seeing. And you might also want to speak with that child's doctor about the changes you're seeing as well. The risk factors that we've discussed can be subtle to detect, and having lots of risk factors, again, doesn't necessarily mean that a person is going to have thoughts of suicide. For example, high cholesterol and heart disease may run in your family, but that doesn't necessarily mean that you have heart disease or that you're going to have a heart attack. However, we'll talk about warning signs, which are observable signs that kind of signal that somebody might be at imminent risk for attempting suicide in the near future. Sometimes we will hear the warning signs and what is being said. So we really want to listen for statements such as, I should just kill myself, I've got no reason to live, people would be better off without me, I feel like a burden, there's no way out of this, I can't live like this, I can't take this pain anymore. Again, don't assume that they're joking. Always start the conversation. We also know that a person's suicide risk is greater if a behavior is new or has increased, and especially when it's related to a painful event or a loss or a change. So we want to look out for warning signs like increased alcohol or substance use, online searches for suicide methods, acting recklessly, such as driving too fast or engaging in risky sexual behaviors, withdrawing from activities, especially if a young person's maybe in sports or clubs, and you notice them really withdrawing from that, that is certainly a warning sign. Just like isolating from family and friends, such as going silent on social media. People definitely take social media breaks. That's normal and that's healthy. But if a young person just kind of suddenly drops off social media, that is a sign to check in. We also know that people who are in distress can develop insomnia, have a really hard time sleeping, particularly if they're very anxious, or can actually sleep quite a bit more, kind of appearing to hibernate. A sudden change in either direction is really something to take notice of. We also can see when folks are saying goodbye or giving away prized possessions. And again, that's a behavior that we don't want to ignore. And then increased aggression and picking fights is also a warning sign that is often missed in young people. If you have a young person who is normally easygoing and peaceful, and all of a sudden becomes aggressive and violent, that's a sign that it's time to take notice. And sometimes the best indication that someone could be at risk for suicide is a sudden change in their mood. We want to watch for things like depression, anxiety, again, loss of interest in activities that that person normally enjoys, increased irritability, shame, humiliation, or extreme embarrassment, or that kind of extreme agitation or rage. Another thing I want to point out is that sudden kind of unexplained happiness, especially after a time when that person has really seemed down, can indicate that the individual has decided on a plan for suicide and is relieved that they're no longer in pain. So again, kind of trust your gut. If what you're seeing in terms of a person's behavior is really, really out of the ordinary, it's time to start that conversation. So in a moment, and actually, I'm not sure that we're going to do this when I don't know if we have enough time for this, so I might not. There is a short film that is involved in this presentation that's called More Than Sad, Teen Depression. This provides a model for effective recognition and treatment of depression in teens. We're actually going to go through all of that in the upcoming slides. So just in the interest of time, I don't think we'll do that. But if you are interested in taking a look at this video later on, just let me know and I'd be happy to share it with you. So some of the key points that are shown and that are important to know when we're thinking about kind of depression and suicide risk with young people is that depression is a common problem that causes significant distress and disruption in teens' lives. It's also important to note that depression is an illness. It's not a character weakness, and it's not something that people can just kind of snap out of. We hear a lot like, snap out of it. What do you have to be sad about? Things like that. But it's not something obviously that you can flip a switch on and change. Depression sometimes develops after stressful life experiences, but it really can occur in any teen, especially if that young person maybe has a family history of depression or other mental health issues. These things are often genetic, and so it can really develop in any young person. We know that depression doesn't go away on its own. We can certainly engage in self-care strategies that might help kind of alleviate the symptoms of depression. But ultimately, it's again, an illness, and it doesn't just go away. And if it's left untreated, it can lead to serious consequences, including suicide. And it's really important to note that treatment for depression is available and treatment works. And so it's really incumbent upon us as caring and trusted adults to help those young people get the treatment that they need. However, research shows that 2 out of 3 teens with depression don't get treatment. So again, we have a lot of young people who are either undertreated or untreated for their depression. We know that treatment for depression and other mental health issues really varies by person and their condition and their severity level. But teens who are showing signs of depression can show improvement within 4 to 6 weeks when they are receiving psychotherapy or talk therapy. For other young people, the combination of talk therapy and medication can make a significant difference. We know that typically for medication, it can take 4 to 6 weeks for a person to really kind of feel the full effects of that medication. So it does take a little bit of time, but typically that improvement can be seen in 4 to 6 weeks. And we also know that many young people benefit tremendously when a family engages in therapy together for a period of time, particularly if that family has sort of undergone a really stressful time. So feeling that support from family through therapy can be very, very helpful for young people. We know that treatment can make all the difference in short and long-term symptom reduction and overall health. Treatment for depression can vary both in its length and nature. For some, depression is an episode from which they will recover, though episodes can reoccur, and treatment will be in response to the symptoms that occur during each episode. Mental health is never sort of black and white. We know that often people have a very kind of up and down trajectory in their mental health throughout their life, particularly if there's a mental health condition involved. For example, depression could involve multiple episodes and will be addressed kind of more like a chronic illness, like diabetes. And in these instances, it may be recommended that treatment continues to help prevent problems in functioning. I often hear stories of people discontinuing their medication, for example, with depression when they start to feel better. It's really important to encourage that person to have a conversation with their healthcare provider. Sometimes discontinuing medication can really lead to, increased symptoms again. You're feeling better because the medication's working, so it's important to keep taking that medication. And again, it's important to have those symptoms evaluated by a trained professional so that, they can work with you to make sure that the young person's sort of core health problem is being treated as effectively as possible. Just like with other chronic health conditions, healthy habits can alleviate some of the symptoms of mental health conditions. I mentioned that earlier, things like exercise, yoga, meditation, a regular sleep schedule, and a healthy diet can improve moods and relieve anxiety and stress. So it's really important to encourage young people to engage in these behaviors, particularly as it relates to sleep. Having that regular sleep schedule can be really, really helpful to alleviate symptoms of mental health issues. And, creating healthy habits as a family is going to benefit everybody. So we talked about seeking the treatment of a mental health professional, and that can be a critical part of treatment. So when you are working with a young person to receive mental health treatment, it's important to make sure that the young person feels like they can talk to the professional. If it's not a good fit, try another. Even for adults, it can take a bit of time for us to find the treatment that works best for us. And it's the same with young people. So it's important that they have somebody that they can, that they feel they can trust and open up to. It's also important to make sure that the mental health professional has the information that you have about that young person's behavior, especially thoughts of suicide. And also make sure to report any unusual behaviors like suicidal thoughts or substance use in particular. And also be vigilant if medication is started or if there is a change in existing medications. Sometimes that sort of period after a medication is first started or changed can really lead to sometimes increased symptoms for a short period of time. Increased depression or anxiety. So this can be a time when it's really, really important to pay attention. Check in with the young person during these key times to make sure that any changes in behavior are noted and brought to the healthcare professional's attention when appropriate. Certainly engaging a child's school counselor can be appropriate. And most importantly, be patient with the young person. Again, it can take a little bit of time for symptoms to improve. And so it's important to be patient. As we discussed earlier, although treatment is effective in most cases, these barriers that are on the screen are common and commonly get in the way, leading to only 1/3 of teens experiencing a mental health crisis getting the help they need. We see that sometimes the symptoms aren't recognized as signs of a possible health condition and are dismissed even by the person experiencing them. There also might be a fear of what treatment may involve, and that can really keep people who are struggling from reaching out for help. And also when somebody is experiencing major depressive disorder, they have kind of this overall sense of despair or hopelessness. And that can lead someone to not want to reach out for help. They may not believe that there is help or that they can be helped. And so, helping that person overcome that feeling can definitely be useful. We also see that when help seeking is not seen as a sign of strength, those who are struggling often don't reach out for help. So helping to create a culture within our schools and in our homes and in society that makes reaching out for help socially acceptable and truly a sign of strength. That could be really helpful. When help seeking is seen as a weakness, mental health conditions are often misunderstood, mocked, or demonized in the media. So people might just be embarrassed to reach out for help. Another thing is that teens generally believe that adults won't understand, so they don't reach out. Typically, when teens are struggling, they'll talk to each other before they talk to an adult. And then teens often don't have the means or access to resources to seek help for themselves. They might not be able to afford treatment without their parents' contribution or have no means of transportation to access treatment. And so again, that's why it's really important to keep conversations around mental health open, so that young people are comfortable reaching out to get that help that they need. So there are many things that we can do to help young people stay safe and help reduce the risk of suicide. Of course, making sure that the young person receives mental health care when needed can help a great deal. Depression and other mental health conditions can be managed well with a minimal effect on the young person's life. Many of us, including myself, are living with mental health conditions, and they can be managed. There is absolutely hope when the right treatment is received. We know that strong and positive connections to family, friends, and the community also play a key role. So helping foster those positive connections is really helpful. It's also important to maintain a safe and supportive home where it's always okay to reach out for help. One way to do this is by limiting access to lethal means. If you do have a firearm in the home, keeping that firearm locked and out of reach of young people is really, really important. I see there are gun locks here today. Feel free to take those and use them in your home, particularly if there are young people present. You can help nurture problem solving and good communication skills. Treat disappointments as learning opportunities. There are many, many disappointments in life, but helping our young people to kind of reframe those as learning opportunities can be helpful. And don't be afraid to ask your child about their mental health, or a child that you care about. Ask about how they feel in response to different events and model expressing emotions. For example, you might say, yeah, I felt sad too when that happened in response to a sad event. I'm a parent. I think as parents, there's a tendency to want to help your child feel better immediately. You don't like to see a young person in pain and struggling, but it's really important to provide space for your young people to feel what they're feeling. And so modeling that by, yeah, that was sad, that was disappointing, I felt that way too, can help kind of normalize those feelings. As I mentioned, it's also important to reduce access to lethal means. About 51% of suicides occur with a firearm. We know that young people are a little bit more impulsive than adults. And so when you temporarily remove access to guns in the home, you're really limiting your young person's ability to use that as a means of suicide when they're having those intense emotional crises. Increasing awareness of the signs of depression in teens can lead to earlier treatment as well as increased support. Because depression can sometimes be a recurring or chronic illness, having an early conversation about depression can help set the stage to address future difficulties if they occur. Think about diabetes, for example. We would not wait until a loved one was in a diabetic coma before getting treatment. So the earlier that issues with, for example, blood sugar are addressed, the less likely the disease will become life-threatening. And so parents, teachers, and trusted adults also need to show that they believe it's okay to ask for help themselves. We can be important role models for help seeking. It's hard for a young person to believe that help is available or even appropriate if adults in their lives aren't believing it and modeling it as well. Here we'll see another clip of Dr. Moutier talking to us more about how to reach out. So I'm going to my cursor, right, there you are.
If you're concerned about someone who may be struggling in your life, the right thing to do is to open up a caring conversation and ask them how they're doing. Ask them directly about whether they're having suicidal thoughts. That will not plant the idea or make somebody at increased risk for suicide. Once you hear what's going on with them, and if you remain concerned, then the next thing to do that's very important is to talk to them about seeking help and to reaching out beyond just help from friends. If the person expresses any thoughts about ending their life, people being better off without them, or extreme desperation or hopelessness, the right thing to actually do is to reach out for urgent help. And you can do that by calling 911, taking them to a local emergency department, or calling the National Suicide Prevention Lifeline at 1-800-273-TALK. If you are worried that your own health is deteriorating, or you're not sure what's going on, but you just don't feel yourself, the right thing to do is to talk to somebody you trust. That could also include your primary care physician, where you might think about getting a referral to a mental health professional.
Obviously, this video is just a little out of date because now we have the National Suicide and Crisis Lifeline that can be reached by dialing or texting 988. That service is available. That service is available 24/7, 365. Again, it's available to anybody at any time. If you're with a young person who's struggling, you can always call or text on their behalf. They don't need to do it themselves if they aren't comfortable. So here are some other tips about how to reach out to a young person who might be struggling. One important thing is to talk to them in private. If it's at all possible, take them aside and have that conversation in a private space and listen to their story. When somebody is in a suicide crisis or even having thoughts of suicide, one of the most important and powerful things we can do is just listen. Oftentimes, this has been my experience. If a person is able to kind of vent, talk about their feelings, talk about why they're feeling the way they're feeling, that can totally de-escalate the situation and eliminate the need to go to the emergency department. Really just having that open conversation and listening to that person in a non-judgmental way. It's, doesn't require a special degree. Anybody can do it. Expressing that concern and caring. Asking directly about suicide in a calm, non-judgmental way is also a really important piece of that. Being very direct and asking the question, are you thinking about killing yourself? Are you having thoughts of suicide? Have you had thoughts about ending your life? Asking very directly is important, and then being quiet and listening. And again, doing that in a calm and non-judgmental way, which again, as a parent or an adult who cares for a young person can be a really scary situation. But it's important to just be there for that person, provide them space to talk. And also reassuring them that help is available. A person can feel really, really hopeless in that situation, and helping that person see that there is help available, that there is going to be hope and recovery on the other side of this, can be really powerful. One of the things that I suggest when talking to people about suicide and their suicidal feelings is asking a lot of open-ended questions. Asking things like, can you tell me what that feels like for you? Can you tell me how this started? What is making you feel this way? Rather than asking questions like, you're not thinking about suicide, are you? That's a close-ended question that prompts an answer, which is inevitably going to be no. Just opening up and having those open-ended questions, expressing some curiosity. I heard the phrase caring curiosity, which I think is really powerful. You're letting that person know that you are a safe person, that you're not going to judge them. And again, often these conversations are enough to de-escalate the situation. It's really important to trust your gut. We've talked about a lot of different things to look out for. So again, looking for changes in words, behavior, and mood. is important. And then trusting your instincts, especially if you have a strong relationship with the young person. So kind of the rule of thumb that I like to suggest is that if you are wondering if a young person is depressed or overly anxious or maybe thinking about suicide, that's generally a sure sign that you should start a conversation and let them know that you're concerned. If you notice something, don't wait for the young person to reach out. Be proactive. You can also engage the school in helping you to reach out as well. And obviously the same goes for anyone in this room. If you are having thoughts of suicide, that's a sure sign that you need to be supported. And it's time to maybe reach out to somebody that you trust to have a conversation. The other thing with young people is that, and adults, I guess, as well, is that sometimes you will reach out to see if they need help and they kind of shut you down or say, no, I'm good. But it's important to keep trying. Reach out again. The first or second or third time even that you reach out, the person might not be receptive, but it's important to keep trying. There are some less helpful things that we can avoid when talking with someone who may be suffering from depression or anxiety or maybe having suicidal thoughts. First is to avoid minimizing their feelings. Those of us who have never experienced a mental health challenge literally can't imagine what it's like. And so it's not fun to hear that those we love are suffering, especially when it's our children, but minimizing their feelings really isn't helpful. You know, I said this to the reporter I was talking to earlier, but sometimes really small things like a breakup, or I should say things that we perceive as small things, like a breakup or a bad score on a test, or, you know, maybe not getting into a college that they were hoping to get into, might seem like insignificant problems compared to what we experience as adults. But we have to remember that for young people, that's really their whole world. And so avoiding minimizing those feelings can be helpful and can show that young person that you're going to take them seriously. We also want to avoid trying to convince a young person that life is worth living when they're at that crisis point. They're really kind of not thinking super clearly. And so getting into these philosophical debates about life being worth living tend not to be helpful. Nor is it helpful to point out all the good things you see in their lives. Sometimes, you know, we say things like, look at everything that you have going for you. How can you feel this way? It's not a helpful thing to say at that point. You can save those conversations till after the crisis has passed. And then avoiding advice to fix it. If a person, for example, is having a heart attack, you wouldn't tell them in that moment to start exercising or eating a healthier diet. So if a young person is in crisis, what they really need is to be heard, listen to their story, and offer to help them find a health professional. And here are a few things to remember when talking to a young person. Again, take it seriously, don't wait to act. Be calm and prepared to listen. As I mentioned earlier, asking a direct question is important. Here's another example. Have you ever felt so bad that you have had thoughts of suicide? Again, this question is not going to put the idea in their head if they aren't already thinking about it. And even if the answer to that question is no, at least you have let that young person know that you care about them and that you are willing to listen to them. You may want to identify a helping professional prior to the talk, but what is most important is that you reassure the child that you're able to help and that you're going to help get them help. And then don't wait to do it. You know, I think sometimes after a conversation like this happens, it can be a little easier to think, well, that's done. They're good now. We're going to move on. But you know, I think continuing to help them find help and work through this is going to be the best thing that you can do. You might want to talk with others who interact with the young person, teachers or coaches, you know, scout leaders, you know, church leaders, other folks that they're interacting with to see if they have noticed any changes in behavior, and then you can help kind of gain their support in helping the young person. And again, remember, a stressor that may seem small to us as adults is not small to a child. So it's important to validate how they're feeling about their current situation, even if you see the situation very differently. There are some steps you can take if a young person reports thoughts of suicide or you suspect that they might be feeling suicidal. As I mentioned, it can be really scary when this happens. And even though it's hard to do, try and stay calm. Let them know that they did the right thing and thank them for coming to you and having the courage to tell you about what's going on. Then reassure them that you're going to help them get the help that they need. Contact a mental health professional for an evaluation appointment as soon as possible. I know that there are extreme wait times right now for mental health services, everywhere. But sometimes just contacting their primary health provider, primary care doctor, that's the word I was looking for, can at least help them get started on a path toward the treatment that they need. Another thing that you can do is reduce the immediate stressors that they're experiencing when possible. This might include things like taking a sick day from school or missing football practice. A good rule of thumb is to think of what exceptions you would allow if your child has strep throat or a broken bone. Just give them time that they need to feel better. And again, I can't stress enough, it's important to take a moment to secure the lethal items in your home. Make sure that any firearms in your home are secured and stored separate from ammunition, or maybe even temporarily held by another person until the crisis has passed. Also, it's important to lock up prescription medications or other items that your child may have mentioned that they're planning to use. Make the environment reasonably safe for as long as necessary. Sometimes we are at a crisis point. That crisis point has been reached, and scheduling an appointment, down the road is not enough. If a young person is in crisis, you need to take action immediately. And the way to kind of determine that you're in a crisis situation that needs this immediate attention is if your child has told you, or a child has told you, that they have planned out how they will kill themselves. You can gain this information through that conversation that you're having. You can ask that question: have you thought about killing yourself? Have you ever had thoughts of suicide? Have things ever gotten so bad that you've thought about suicide? And then the next question could be, have you thought about how you are going to take your life? And if they say no, then kind of the immediate crisis isn't as severe. But if they disclose that they have thought about it, or maybe they've taken steps to get lethal means, that's a more serious crisis that needs more immediate intervention. Another way to determine if a child is in crisis is discovering a suicide note written by the child online or on paper. A lot of young people will post things on social media that resemble suicide notes. And again, that's a sign that the child is in crisis. If your child tells you that they're hearing voices telling them to kill themselves, again, that's another sign that they need immediate attention. If you discover that your child has made a non-lethal attempt, that's a sign of a crisis. Again, there's that difference between suicide attempt and non-suicidal self-injury. If you notice that a child is harming themselves, you might see things like scars on their body. Have that conversation about what was behind that. And if there was suicidal intent, and if there was, then that's a sign that the child is in crisis. You might also just feel in your gut that the child is not safe and you're afraid to leave him or her alone. Again, that's a sign that young person is in crisis. And if you're at that crisis point, the most reasonable action is to get help from a trained professional who can assess the young person and help you figure out next steps. You can certainly take the child to an emergency room or mental health center for an evaluation immediately. Again, you can call the Suicide and Crisis Lifeline at 988. They are really good at helping you kind of figure out what the most appropriate next step is. It's important to not leave that young person alone until they've been assessed, and just make sure that you're able to supervise them at all times. Get help if you need help in doing that, for sure. By talking directly and compassionately with the child about their concerns and thoughts about suicide, that really sends the message to them that you notice and that you care and that you're going to help them. In addition to helping that child, you can also be aware of risks that you might notice in their friends or peers. When asking about their friends, you might start by asking if they have any friends that they've been worried about. Or you may comment on specific behaviors. You might say something like, I noticed the last time John was over at the house, he seemed kind of down. How do you think John's been feeling? And then later, do you think John may be feeling suicidal? So it's possible to kind of help them help their friends by asking those questions. And then if you get a report that your child's peer is feeling suicidal, you can contact their school or their parents, but contact someone and let them know what you have learned. Again, I mentioned earlier that young people typically don't talk to adults right away. When they're having these feelings, they talk to each other. And so kind of helping your young person support their friends in this way can be really helpful. Of course, if there's an emergency, such as a suicide attempt in progress, call 911. Or if your own safety is in danger, calling 911 is really the most reasonable thing to do in that moment. There are also resources available to help 24/7. If you don't know about these resources already, now's a great time to write those down. As I mentioned before, you can connect with the Suicide and Crisis Lifeline by dialing 988. This isn't going to apply to youth, but if you have a veteran, press 1 for veterans. If you have a Spanish-speaking family, press 2, and they will reach a counselor that will be able to speak to them in Spanish. Right now, the text 988 line is available only in English, but I know they are working on rolling that out in other languages as well. A lot of young people don't like talking on the phone. I don't like talking on the phone. So another good option is the crisis text line. There are a couple different ways to reach that. For English, you can text the word talk to 741-741. If you are working with a Spanish-speaking family, text the word ayuda to 741-741. Again, the crisis text line is staffed by trained counselors 24/7. They will provide very similar support that the National Suicide Crisis and Lifeline will support just via text. If people are more comfortable with that, they can certainly do that. So just a reminder, talking honestly with your child about suicide can save lives. Really, all it takes is one caring and compassionate adult to take notice and start the conversation. And oftentimes that person can be you. So, coming to this presentation today and learning more about how to support your young one, the young people in your life, your young ones, the young people in your life is really, really important. There is more information available on how to support youth at the American Foundation for Suicide Prevention's website, afsp.org. We also have a site for Wisconsin, afsp.org/WI, that you can take a look at. These trainings are available for free, and they can be provided to schools. We're a statewide chapter, and so, we can travel and come and give information if needed. There's also a lot of downloadable resources at this website as well. Together, hopefully, we can create a culture that's smart about mental health, which will save lives and vastly improve the lives of many more. And I wrapped up 10 minutes early. So thank you so much, everyone. I'm happy to take questions. In less 10 minutes.
If the More Than Sad video is available.
Yes.
Online.
I can get it. I can send it in an email to you.
Okay.
Yeah.
So that those of you that asked that online, we will get that link to be able to put that in there for you guys to view.
Yep.
I did put the teaser page for that, but I figured that was the question that we had that was asked.
It's about 25 minutes, so we wouldn't have had time. But
sure,
if I talk faster, maybe. But yeah, I can make sure that's available.
That's all right. So at this point, we'll open it up to people that are in the other locations. Leslie's watching them. I'm just going to do a quick escape here. Maybe. Sure, please do. I'm going to pull this. That's right. We're backwards on this. put this back up here just to remind people that the handouts are available online. Leslie, did anybody indicate that they have any questions? So many communities do have different counseling programs within their schools that could be supported that increase access to youth to counseling within the school setting, which helps a lot of families out. So if you're not familiar with some of those programs, I encourage you to reach out to your local health department, who would be most likely connected to your local suicide prevention efforts in your community. We've got nothing else coming in. Here.
So I have, I'm kind of interested in, have you heard of mental health 360-degree program?
I haven't.
Okay, so I was online and I watched a thing about it, and what it is for what it says is that there's a lot of people that have mental health issues that don't necessarily want to go somewhere. They want to be kind of self-treat themselves.
Yeah.
And so this program is set up that they can go online, plug in, you have anxiety or you have depression, it'll tell you things that you can do to kind of self-help yourself.
Yeah.
Have you ever heard of it?
I haven't, but I'm going to check it out because again, like I mentioned earlier, there's such long wait times for mental health, like to get in with a counselor, or psychologist, or psychiatrist. Something like that would be really, really helpful.
Yeah.
Yeah.
And that's what it kind of is geared at, is self-help. Now, that's not going to be pertinent for everybody, but
no,
certainly those people that know they need they want help if they want to go see someone. It might help them with it. But it's called 360-degree program.
I'm going to take a look at that. That's really good to know it's out there.
Okay.
Yeah. And I don't want to steal Erica's thunder because I know she's going to talk about LGBTQ suicide, but the PRISM program is a statewide resource that's available for LGBTQ young people. She'll talk about that, I'm sure.
Yes.
But there are I will say for youth in particular, there are not a lot of like peer support resources or programs like we have for adults. And so something like that I could see being really, really helpful for a young person who's trying to maybe manage their symptoms while they're waiting to seek treatment. The other thing I think is, we talk about self-care. The other thing that's really important is collective care and making that young person feel as connected as they can, supported. I think that is as important as self-care. So I think by working those two things together, it could be really, really helpful. Yeah.
And of course, there's a fee and everything associated. It's intriguing.
Good. I'll take a look at that. Thank you for letting us know.
Sure.
So we have 5 minutes. If there's no more questions online, I'm just going to do a quick couple points here. We do have a QPR training coming up here locally at the Medford office at the Medford campus. We're also, many communities are able to do the Question, Persuade, Refer program training through online as well. So if people are interested in potentially participating in online training, that is one of the things that we can do, is to really learn how we can just ask that question and be more comfortable asking that question if people are thinking about suicide. So that, in addition to those of you that are in the Medford area, there is going to be 2 showings of The Ripple Effect at the Broadway Theater tonight that chronicles Kevin Hines' story, which you can see here on the slide, as well as through the promotional items. Just a reminder, please make sure that if this is the only session that you're attending today, that you do fill out our evaluation. This is the evaluation link or the evaluation scan code. For those of you in the room, if this is the only session that you're attending today, we do have paper form evaluations up here that you can fill out. Just make sure you indicate that this is the session that you attended.
Thank you, Sara.
And thank you, Sara. Yes. Farming and ag communities at 3:30. Thanks, everyone.